In America, it is no secret to anybody that we have a major obesity epidemic as well as an epidemic in diabetes. They are both directly related, and they are both getting worse.
Vermont Senator Bernie Sanders earlier today on Capitol Hill discussing what he and others perceive to be as a health crisis in America. Sanders also, interestingly, called out the Food and Drug Administration for failing to do more to prevent it, or at least slow it. Sanders also spoke to CBS News on President-elect Trump's pick to run the Department of Health and Human Services, Robert F. Kennedy Jr.
From what I've not talked to Mr. Kennedy in a number of years, actually. I think what he is saying about the food industry is exactly correct.
CBS News correspondent Natalie Brand, who interviewed Senator Sanders, joins us now. What else did the senator tell you, Natalie, about RFK Jr.?
Major, good to be with you. Well, Senator Sanders, as chair of the HELP committee, has really sounded the alarm on ultra-processed foods and the food and beverage industry, drawing comparisons to the fight against big tobacco decades ago. Interestingly enough, RFK Jr. has also talked a lot about food policy, additives, taking on the food industry. That's something part of his platform. It's taken off online with the Make America Healthy Again movement. So I asked Senator Sanders if that's an area where he could potentially work with the Trump administration if RFK Jr. is confirmed.
I think you have a food industry concerned about their profits, could care less about the health of the American people. I think they have to be taken on. I think, on the other hand, when when Mr. Kennedy talks about taking fluoride out of our water system, I think what the scientific community will tell you that would be a disaster in terms of dental health in this country. His views on vaccine are very wrong in so many ways. So we will see how the process unfolds. So I think what he's saying about the food industry makes sense to me. A lot of other things that he's saying are extremely dangerous.
So I tried to press Senator Sanders on if he's made up his mind about President-elect Trump's health picks, how he's preparing for the confirmation process ahead. Take a listen.
We are preparing. I mean, we're going to be prepared to ask the right questions. And it's not only the confirmation hearings, it will be discussions that we have behind closed doors as well.
At this point, have you made up your mind, or you're going to go through the process? Any other health-related, as the chair of HELP, are there any other health-related picks, agency picks, that you're concerned about?
Well, I think I know Kennedy somewhat over the years. I do not know his other picks, so I'm going to have to sit down and talk with him. The other thing I think that's important is Trump over the years, and Kennedy himself, has talked about as a health problem the fact that we pay by far the highest prices in the world for prescription drugs. And if I'm not mistaken, Kennedy has talked about the need for Americans not to pay more than the people in other countries. I think that's exactly right. And I hope Trump keeps his word in terms of going forward in something that he has talked about for years, substantially lowering the cost of prescription drugs in this country.
Major, as you know, though, the political reality going into next year is Republicans will have a 53-seat majority in the U.S. Senate. That is political leverage for them to get some of their big priorities and cabinet picks approved, Major.
Leverage indeed. Natalie Brand, very good interview. Thank you so very much.